Chapter 3, Specimen Processing and Handling. 348. Listed below are colors of conventional stoppers for evacuated tubes. Which stopper color would be selected most often to collect specimens analyzed in the chemistry department? Down here we have green, gray, lavender, red, STT. The answer is red, SST. So red SST is the chemistry department. 349. Listed below are colors of conventional stoppers for evacuated tubes. Which stopper color would be selected most often to collect specimens analyzed by the hematology department? The answers are gray, lavender, light blue, red, SST, and the answer is lavender. 350. Which of the following departments in the clinical laboratory performs ASO titers, cold agglutinin titers, and rapid plasma reagent analysis? The answer is immunology. 351. Which of the following laboratory departments offer a profile of tests that analyzes amylase, bilirubin, electrolytes, glucose, ALT, AST, BUN, and LDH? Clinical chemistry. 352. Which of the following departments in the clinical laboratory is most often responsible for analyzing specimens for prothrombin time and APTT analysis? So for PT and APTT analysis. So which department? Coagulation. 353. Which department of the clinical laboratory is most likely to perform an AFB culture? Microbiology. 354. Which of the following colored conventional stoppers for evacuated tubes would most likely be delivered to microbiology for analysis? Yellow. 355. Which of the following departments would most likely perform a type and cross-match analysis? Immunohematology. 356. List below are colors of conventional stoppers for evacuated tubes. Which stopper color would be selected most often to collect specimens analyzed in the immunohematology department? The answers are red, red SST, light blue, royal blue. The answer is red. 357. The condition when the patient is at rest in a supine position 12 hours after the last ingestion of food, exercise, or activity is basal state. (358) Normal variations of blood constituents throughout the day are called diurnal rhythms. 359. Normal spans of values for laboratory tests are called reference value. 360. A clinical situation in which the water from the plasma portion of the blood filters into the tissues, causing non-filterable values in the blood to falsely increase, is called hemoconcentration. 361. Cloudy serum or plasma caused by an increased lipid content is called lipemic. 362. If a patient finishes drinking a glucose solution during a GTT, which is glucose tolerant test, at 7:30 a.m., what time should the first specimen be drawn? 8 a.m. So 30 minutes later. 363. Which of the following tests is usually ordered as a series of samples collected at timed intervals? Blood cultures. 364. If a physician orders a 3-hour glucose tolerance test on a patient, how many blood collection procedures must be performed as part of the GTT? 5. 365. When labeling blood culture specimens, what information is required in addition to routine labeling information? Number of the series. 366. When labeling a blood culture specimen, what information should a phlebotomist record in addition to routine labeling information? Venipuncture site used. 367. At what temperature do cold agglutinins react best? 4 degrees Celsius. I don't know why I thought it was 37. Let me look at my answers. Yep. I thought it was 37, but it said 4 degrees Celsius. Okay. 368. collection of blood specimens for which of the following tests may incorporate the use of a typinic band? Type and cross match. So maybe I pronounce it, maybe it should be type next. Or just remember, when you see type next, is type and cross match. 369. Which of the following would appear in addition to routine labeling information on a specimen collected as a part of a GTT? The answer is timing of the specimen. 370. Which of the following specimens requires transport shielded from light? Bilirubin. 371. Which of the following specimens requires transport shielded from light? And I have a bunch of answers, but the answer is carotene. The next one is the same question. Which of the following specimens requires transport shielded from light? The answer is erythrocyte protoporphyrin level. So if I were to ask the question, since it's the same question, I'll say, which of the following specimens requires transport shield from light? Would be bilirubin, carotene, and erythrocyte protoporphyrin level. Yes, so that's red blood cell, carotene, and bilirubin. Okay, the next one is 373. Which of the following specimens must be transported at 37 degrees Celsius? Cold agglutinin titers. So even though that's how it's transported, it reacts best at 4 degrees Celsius. .374. Which of the following materials is most commonly used to transport specimens shielded from light? Aluminum foil. 375. Specimens that must be transported chilled should be transported how? In a cup filled with ice cubes and water. So these are transported chilled, not frozen. Chilled. 376. What is the best method of transporting specimens at 37 degrees Celsius? Ice bath. 377. Which of the following specimens requires chilled transport? And all of these is 4 questions with the same, is 4 question that is the same. So I'm just going to name all of them. So which of the following specimen requires chill transport? One would be ammonia, fibrinogen, gastrin, and renin. .381. If a laboratory test procedure requested by a physician cannot be analyzed by the in-house laboratory, the specimen should be sent to which type of laboratory? Reference. 382. Which of the following containers should hold a specimen that has been wrapped in absorbent material for transport to a reference lab? The answer is secondary container. 383. Which of the following characteristics applies to a drug that is monitored by a therapeutic drug monitoring system? Narrow therapeutic toxic ranges. 384. Which of the following drugs characteristically incorporated into a TDM program? Aminoglycosides is spelled AMINOGLYCOSIDES. 385. Which of the following is a common reason for rejection of specimens collected as a part of a TDM program? Failure to collect specimen at the appropriate time. 386. Before a specimen for TDM can be collected, there must be verification of patient's last what? Medicational dose. 387. A TDM specimen that is collected approximately 30 minutes prior to the next scheduled dose is for what type of medicational level? Through. It's spelled TROUGH. . 388. A phlebotomist is to collect a blood specimen at 7 a.m. as part of a TDM program. The phlebotomist has several specimens to collect at that time. How many minutes before or after the hour can she or he collect the specimen? And the answer is 0. You have to collect it on time. 389. What kind of form must be completed for forensic specimens? Chain of custody. 390. Which of the following agencies defines requirements for the collection, processing, and testing of urine drug screens? NIDA. 391. Which of the following security measures is routinely performed by collection sites for urine drug testing to ensure specimen integrity? Place bluing materials in the toilet. 392. What is the minimum acceptable volume of a specimen for urine drug screening according to NIDA? 60 milliliter. $3.93. What temperature range must a urine specimen fall within to be acceptable for drug screening according to NIDA guidelines? 90.5 to 99.8 degree Fahrenheit. $3.94. Which of the following laboratory tests may be performed on a random urine specimen? Urinalysis. $3.95. Which of the following laboratory tests requires a clean catch midstream urine collection? Urine culture and sensitivity. $3.96. Following collection, a specimen for urine culture and sensitivity must be delivered to the lab within 60 minutes. $3.97. If a urine specimen cannot be delivered to the laboratory immediately following collection, the specimen should be stored how? In a refrigerator.